Okay, let's dive into a really powerful study that uncovers the hidden forces shaping children's health in the tea garden communities of Bangladesh. You know, it's a story of how things like income, education, and family life all weave together into this complex web that can either lift a child up or trap them in a cycle of poor health.
Right from the start, the study hits you with this absolutely staggering global statistic. It's there to frame just how high the stakes are when we talk about child nutrition. I mean, this isn't just about kids being a little small for their age. We're talking about a matter of life and death, and on a massive scale.
Just think about that number for a second. 45%. That's nearly half of all deaths for children under 5 years old. It's a crisis, and it's driven by factors that you often don't see, things that are buried in the daily struggles of families living on the margins. And to really get it, we need to go to a very specific place. So to understand this, researchers zoomed in on a specific and pretty vulnerable population, the children living in the tea gardens of Sylhet, Bangladesh. These are communities that are often dealing with really deep-seated poverty and a lot of isolation from the rest of the country.
So how do you even begin to measure the health of an entire community of kids? Well, they used a key tool, the body mass index, or BMI. It's a simple but really powerful way to get a quick snapshot of a child's nutritional status. Basically, by comparing their weight to their height, you can spot issues like wasting, where a child is just too thin for how tall they are.
And what they found? Well, it was stark. The data immediately pointed to a crisis. The vast majority of these children fell into that undernourished category with very low BMI. It wasn't even a question. This was clearly the #1 health problem they were facing. Okay, so this led to the big question, the central question of the whole investigation. What are the root causes behind these alarming numbers? Because, it's not enough just to know there's a problem. You have to understand why it's happening. The investigation really honed in on 4 key areas of family life, 4 factors they suspected were all tangled up together: how much money a household makes, what the parents do for a living, their level of education, and crucially, how old the mother was when she had her child. All right, let's follow the evidence. Let's see what the data actually revealed for each of these factors, because this is where the story really starts to come into focus, and you can see the connections. The first clue? Extreme poverty. And I mean, get this, a shocking 83% of families were living on less than 7,000 Bangladeshi taka a month. To put that into perspective for you, that is less than $80 a month to support an entire family.
And the data showed a direct, just undeniable link. It's right there in black and white. There's this clear upward trend. As family income goes up, even just a little bit, the average child's BMI goes up with it. A little more money directly translates into better nutrition. It's that simple.
So then, the investigation turned to education, and the findings here were just as stark. Looking specifically at the mothers, nearly 84% of them had only a primary school education or no formal schooling at all. Let that sink in for a minute.
And the evidence here is just as clear as it was with income. Children whose mothers had completed at least a secondary education had consistently higher, healthier BMI scores. It makes sense, right? Education empowers mothers with knowledge about health, about hygiene, and about nutrition that directly benefits their kids.
Okay, next up, occupation. For fathers, it was pretty straightforward. More stable jobs in business or service correlated with healthier kids compared to those doing uncertain daily labor. But for mothers, a really interesting pattern popped up. In this specific context of extreme poverty, mothers who were housewives, which means they could dedicate more time to direct caregiving, actually had children with slightly better nutrition. It just goes to show how critical that hands-on care is when every single resource is scarce.
And the final piece of the puzzle concerned the mother's age when she gave birth. The data showed that nearly 40% of the children in this study were born to very young mothers, between 18 and 25 years old. This is pretty consistent with the common practice of early marriage in the region.
And what's the takeaway here? Well, it turns out that early motherhood was another significant risk factor. Younger moms, who are often facing their own biological and social challenges, were more likely to have undernourished children. It's another crucial piece of this puzzle.
So, the study makes it crystal clear that these aren't just a bunch of separate problems. They are all part of a powerful, interconnected web of hardship, where one disadvantage just fuels the next one.
Let's just walk through how this vicious cycle actually works. It often starts with low parental education. That leads to insecure, low-paying jobs. That, in turn, creates persistent poverty, which then limits a family's access to nutritious food and decent health care. And the result of all that? Widespread child undernutrition, which can then impair a child's development and their ability to learn, trapping the next generation in the exact same cycle.
So the big question is, how do you break a cycle like that? The great thing about this research is it doesn't just diagnose the problem, it actually points us toward a path forward.
The study's conclusion is that you can't just fix one thing. There's no silver bullet. Tackling this crisis requires an integrated approach. It means addressing poverty with economic support, investing in education, especially for girls, empowering women with family planning, and improving basic infrastructure like clean water and healthcare. And you have to do it all at once.
And all of this leaves us with a final, vital question, one that really underscores why this research matters so much, far beyond these tea gardens. At the end of the day, the health of its children is the foundation of any nation's future. And as this study makes so clear, securing that foundation isn't simple, but it is a challenge we absolutely have to meet.